It's all about rejuvenation. Patients come to see us and they're frustrated. How is it that this happened to me? It was just yesterday I looked young and youthful and all of a sudden everything has dropped. Well, there are really important studies that have been done out there that show there are two peaks. One is in your late 40s and the other is in your early 60s. And that's when things will change like this. We have patients come in and they say, hey, I did not look like this yesterday. What's going on? So we take somebody like this and we sit down with them and we help them break it down into the different thirds of the face. And we say, where do you feel that you have aged the most? Most patients come in and say it's the neck. There is no question that the neck is what reveals your age more than any other part of your face. What's going on down here is things have started to sag. You've had bone loss through osteoporosis. You have involution and everything slips off. On top of that, your glands can start prolapsing down and they can truly obstruct and really take away from that beautiful sharp angle of your jaw. What are the different elements that you're looking to address and to achieve a youthful look and projection from? In the eyes, what we're looking at is, do you need a little bit of a brow lift? Do you need a blepharoplasty? And that's removing a little bit of the skin from your upper eyelid and your lower eyelid. In the midface, what's going on, that zygomatic bone is involuting through osteoporosis. It's melting away, and then everything else drops off of there. Some patients will come in and say, Dr. Claytor, I think I need just my eyes done. Very quickly, I will demonstrate to them that it's actually their midface that has dropped down, and that is what's really caused the biggest change around their eyes. So when we make incisions, we hide them along their hairline in the sideburns. We sneak it back behind the part of their ear, this little piece of cartilage in their ear, and then we sneak it back here. Through these incisions, I'm able to go in and address that SMAS, that superficial muscular aponeurotic system that is dropped. When this drops down here, it opens up the tear trough, and now all of a sudden their eyes look very tired. So what I do is I enter into the SMAS, and we enter into it right here by going down underneath. Now we're underneath the superstructure. That's where the retaining ligaments are. We release those retaining ligaments. Now we're able to lift and elevate the entire face with what we call a composite flap. A composite flap means the SMAS is attached to the overlying skin. By lifting this up and re-insetting it up in a superior and lateral orientation, we're able to give patients that natural, youthful, rejuvenated look that they are asking for. In the process, we rebuild the cheek, and that really helps give a beautiful cheek eyelid contour so that that entire complex looks much more youthful. Now we're down into the neck. You need to make an incision up underneath the chin to go in and shave off that lower part of that gland that's sticking down. This is a huge topic today. There is so much controversy going back and forth about the submandibular gland. Should you remove it? Should you not remove it? Is it safe to remove it? Is it represent a high risk of bleeding during surgery? All of these things are valid, and that is especially why you should be going and seeing a highly skilled surgeon who has years and arguably decades of experience doing this kind of operation, which is right here. So when you remove all this, you're able to recontour and redevelop, and now you are giving a patient this kind of result. And so you can see these tiny little incisions here have allowed me to rejuvenate around their eyes with little blepharoplasty incisions. We've been able to elevate the cheek, that malar mound, and we've been able to go down and recontour the jaw and give a beautiful, very youthful cervical mental angle that gives you that strong definition of the jawline and really shows a rejuvenated, youthful presentation, which is what patients are looking for. They're not looking for something fake and unnatural, and we like to give them that rejuvenated look. This is the kind of experience that patients are looking for. I hope you found this helpful. Thanks so much.